The cash price trap with Wegovy or Zepbound begins when self-pay patients compare only the heavily advertised first-month number. Compare the long-term dose, exact product, required fees, and refill rules before paying. A cheap opening price can become expensive by month 3. A higher price may offer better value when the supply, follow-up, and monthly total are dependable. This comparison covers injections. Wegovy contains Semaglutide, while Zepbound contains Tirzepatide. Wegovy copies one fullness signal, while Zepbound copies that signal plus another. These signals are released after eating, reducing hunger and making smaller meals feel sufficient. Treatment starts low and increases, while some cash programs charge more at higher doses. The comparison is not brand against brand. Compare the complete monthly cost at the maintenance dose used long-term. Include medicine, prescription visits, required tests, shipping, supplies, and membership charges. Compare the same number of treatment days, not packages covering different periods. Identify the seller first. A manufacturer pharmacy, local retail pharmacy, and telehealth company may quote totals. One telehealth price may include the prescription visit. Another may advertise only the medicine. A third may require a recurring membership before authorizing refills. Next, identify the exact product and device. A Wegovy pen approved by the U.S. Food and Drug Administration, or FDA, differs from medicine specially mixed by a pharmacy. A familiar ingredient name can hide differences in manufacturing, testing, concentration, device, and dosing instructions. This specially mixed medicine is called a compounded product. It is not an FDA-approved product or a generic version of Wegovy or Zepbound. Compounded drugs do not receive the same pre-sale review for safety, effectiveness, and quality. The FDA has reported dosing errors involving compounded vials sold as alternatives. Before buying, verify exactly what the prescription and label describe. Check whether the pharmacy is state licensed and the prescription clearly identifies the product as compounded. The label should state how many milligrams are in each milliliter. Never assume the unit marks on a syringe equal milligrams. Once you confirm the product, compare costs. New Wegovy savings offer users may pay $199 for the 0.25 and 0.5 milligram fills. Later, Wegovy costs $349 through 2.4 milligrams or $399 at 7.2 milligrams. The Zepbound Quick Pen, a pre-filled injector pen, starts at $299 for 2.5 milligrams and costs $399 at 5 milligrams. Doses from 7.5 milligrams cost $449 when purchased again within 45 days. Missing that deadline can raise the regular price to $699. Compare matching treatment stages. Do not compare Wegovy's promotional starting month with a Zepbound maintenance month. Do not compare a low starting dose with a higher long-term dose. Write down the price at each planned dose before choosing either route. The highest dose is not always right. Some patients get enough appetite control at a lower approved maintenance dose. Others need a higher dose for a useful response. Your budget needs a range because the long-term dose cannot be guaranteed before treatment begins. The lowest advertised price may be the least useful number. It often applies only at first. Obesity treatment requires repeated payments. An 8-week bargain can become unaffordable after dose increases, promotion endings, or added fees. Two patients can buy the same brand and face different yearly costs. One gets good control at a lower maintenance dose. The other may need a higher dose simply to get adequate control. The cheap advertisement never predicted that annual bill. When the monthly cost becomes impossible, people may stretch injections, skip weeks, or stop. Appetite control can weaken, and weight regain becomes more likely. After a long interruption, contact the prescriber before restarting because the dosing plan may need to change. The budget problem has now become a treatment problem. To prevent that spiral, estimate annual costs first. Calculate both lower dose and higher dose scenarios when the final dose is uncertain. Add the visit schedule and any tests required by the prescriber or program. Include needles or syringes when a vial requires them. Then add taxes, shipping, memberships, and fees that appear only at checkout or after enrollment. The yearly estimate fails if the next dose is unavailable. A low price has little value when the pharmacy cannot fill the next prescription. Ask whether the prescription can be transferred and whether unshipped orders can be refunded. Reliable supply protects the treatment schedule and money already committed. Supply includes safe delivery. The seller should show the medication name, dose, quantity, dispensing pharmacy, and delivery conditions before payment. These injections are usually refrigerated, but their labels allow limited room temperature storage. If a box arrives warm, damaged, or poorly labeled, check the storage rules and replacement policy before using it. A cash plan works only when 3 conditions hold after the first shipment. You must tolerate the dose, obtain the next supply, and afford maintenance. The cheapest option fails when any one condition breaks. Clinical support also matters because early corrections can prevent expensive medicine from being wasted. Tolerance can erase an apparent bargain. Wegovy and Zepbound both reduce appetite, but response and side effects differ between patients. Even strong appetite suppression has no value when nausea, vomiting, constipation, or poor food intake prevents continued treatment. A medicine creates value only while the patient can keep using it. Medical follow-up, therefore, has financial value. A clinician can slow dose increases, manage common side effects, and keep an effective dose unchanged. Without support, patients may discard expensive medicine, refill the wrong strength, or abandon a treatment that could have worked with a slower plan. Beyond clinical support, insurance adds another hidden layer. A cash purchase may not count toward your deductible, the amount paid before insurance starts sharing costs. It may also bypass an insurance claim, leaving no denial to appeal. Ask how cash purchases affect the deductible and future coverage requests. Self-pay programs and savings cards follow separate rules. Some manufacturer cards require employer or private insurance and exclude Medicare or Medicaid. Cash programs can have different eligibility rules and refill deadlines. Confirm which program produces the final checkout price. Avoid prepaying for many months unless the refund terms are clear. Your dose, side effects, or insurance status may change. The company can also change its program. Paying month by month preserves flexibility when the medical plan, supply, or price changes. After checking those rules, create 4 boxes. Box 1 is the exact product and device. Box 2 is the expected maintenance dose. Box 3 is the monthly and yearly total, including insurance effects. Box 4 is continuity, including supply, shipping, refunds, and medical follow-up. Run one final stress test. Can you still afford the plan if the introductory discount disappears next month? If the answer is no, the plan is not sustainable. Choose a lower cost approved route, pursue coverage again, or discuss another treatment instead of depending on a temporary price. Do not switch between Wegovy and Zepbound on your own, because one website becomes cheaper. They contain different active medicines and use different dosing schedules. A new prescription and transition plan may be needed. One cheaper shipment is not worth a dosing error or an avoidable interruption. The best cash purchase is not automatically Wegovy or Zepbound. It is the option with a realistic maintenance cost, an authentic product, reliable supply, medical support, and a tolerable dose. Compare the full year, not the first month. That change exposes most cash price traps before they become expensive treatment interruptions. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.